a loved one battle with drug use is a devastating experience and can be soul-crushing if that loved one dies as a result. According to the Centers for Disease Control, more than 90,000 people died of an overdose in 2020, making it the worst year on record for the United States. In New York City, more than 2,000 people perished, which is why city and health officials are trying something new in order to curb the number of people that die from drug overdoses. New York became the first city in the U.S. to open safe injection sites. The two locations opened in Upper Manhattan earlier this week to mixed reaction from residents. But Mayor Bill de Blasio and other health officials insist it's a great option to fight the opioid crisis. Here's how it works. People heading to a supervised injection site are given sterile equipment for drug consumption. They're usually placed in small and secure booths with clinicians on staff just in case anything goes wrong. And since these facilities have the local government stamp of approval, the users would be free from criminal prosecution. When it comes to using supervised injection sites against drug overdoses, the U.S. is late in the game, believe it or not. There are more than 100 legal consumption facilities worldwide throughout Canada, Australia, and Europe, dating back to 1986 when the first one opened in Switzerland. It's almost a given that other U.S. cities have taken steps towards supervised injection sites too. Cities like Philadelphia, San Francisco, Boston, and Seattle will be looking at New York to assess the results. The question remains, will these sites actually work in this country, or could they discourage sobriety? Dr. Carl Hart is here to help us break all of this down. He is a Ziff professor of psychology at Columbia University and the author of Drug Use for Grown-Ups, Chasing Liberty in the Land of Fear. Good evening, and thank you so much for coming on. Now, you are one of the first tenured Black science professors at Columbia, and you've created quite the stir by coming out very candidly about using drugs like heroin on a regular basis. So tell us about your recreational drug use and how you feel that you've managed to use safely.
Oh, that's funny. I didn't know I was there to talk about my drug use. I thought I was going to be talking about the supervised consumption facilities. You know, the thing that I have is
We getting
30
into the harm
years.
reduction of this. Oh yeah.
Yeah, but I think it's important for your audience to know that I have 30 years of research experience, and so this isn't just someone talking about their opinion, and the fact that I came out of the closet about being a drug user. I was just trying to be adult. There are millions of Americans who use drugs on a regular basis, but they're in the closet, in part because of the political consequences of being honest about what we do. Like, for example, this safe or this supervised injection facilities in New York City. We have had these same facilities in this city for more than 5 years or so. They've been in operation. It's just that now the mayor has decided to recognize these facilities. And you know what else? Those cities that you talked about, like Seattle and San Francisco, they too have supervised facilities in their cities. But in this country, we are like children. We are being dishonest about these things, but they are already in operation in those cities, just like the one in New York City has been in operation for years.
So, controversy aside, people, some people question a lot of what you speak about, teach about, but you're actually a bit of a hero in the harm reductionist community. And I want you to give us some more perspective here about where the stigma really comes from behind the regular use of drugs and how these supervised injection sites can break through some of that stigma.
Yeah, well, the people who find what I say objectionable, they don't actually read or they don't actually allow their position to be dictated by evidence. And so it's like saying that somebody who doesn't understand racism is saying that it doesn't exist because they know nothing about it. So I don't really try to convince people who don't play by the rules of evidence. That's not what I do. Well, but when we think about this issue of supervised injection facilities, these facilities one of the goals of these facilities is to make sure that people have a place to go where they can have clean works, they can have lighting, they can have a comfortable place to be, and they don't have to be out in the public, in part hiding and increasing the risk of other sort of potential dangers like missing a vein or something of that nature. So most of the people who use these facilities are people without homes. And so in part, these facilities are helping to do something that our society has not done, make sure everyone has a home. Because if people had homes, we wouldn't need these facilities. That's number one. And number two, when you talk about the overdose concern, the major concern with overdoses is that people have contaminated substances. That is, they don't know exactly what's in their substances. These facilities do nothing to address that issue. And so, if we really were concerned about addressing the overdose issue, we can make sure that people had a safe supply, like they do in Vancouver, like they have tried to do in other places. And so we have to make sure we disentangle what the real issues are and not the issues that idiots would have us focus on.
Mm. So I was reading a bit about your work, and you do talk quite a bit about the structural issues that might lead to people using, but then what goes awry, right? In this instance, you're talking about not having a home. Could you speak more about what's happening in Vancouver in this idea of having a clean supply? Are you suggesting that New York would fare better if New York offered the supply?
Yeah, well, there are a number of ways to address that issue. For example, if we are concerned that people are having contaminated substances, there are a number of locations around the world where they have these facilities where people submit small samples of their drugs, and then they get a chemical printout, a readout of what's contained in their substance. And if the substance contains something toxic or something potential deadly, they don't take the substance. We have that technology in this country, but we don't use it. We don't make it available to our citizens like they do in the Netherlands, like they do in Spain, like they do in Portugal, like they do in Colombia, in a wide number of countries. So that's one way you can address it. Another way you can address it is by simply making sure that people, for example, who use heroin, like they do in Vancouver, they have a safe supply. There is the city makes sure that there is a safe supply of the substance. So the issue oftentimes is not the substance when we think about problems that people are having, like addiction and all of these issues. That's the substance are rarely the problems. Our society, our country, we are a young country, relatively speaking, to when we compare with other countries, and we behave like children when it comes to drugs. When we think about whenever you think about a drug issue, just replace the drug with sex, sexual behavior, and imagine if we behaved in the same way with sexual behavior. So we need to grow up.
Well, let's talk about harm reduction, because I'm interested in how do you get the general public to really understand harm reduction and kind of break through a lot of the negative stereotypes, frankly, that we have about communities and who does drugs and who can romanticize drugs versus who is harmed by drugs. I'm thinking right now about the fact that New York put both of these centers uptown, right? So it's highly black, it's highly Latinx, etc. And if we're trying to not do harm, are these in the right places? First of all, are they perpetuating stigma? Are they really helping? And what's the bigger picture here if we're really trying to support people who are struggling?
Well, in terms of the location, you have to go where the people are. And so a number of folks are in those locations, and so you make sure that you have the facilities in those locations. That's number one. And you can make sure that these facilities are safe and people are not concerning the neighbors. That's not a difficult thing to do, because many of the people who use drugs just want to be left alone. Now, when you ask the question about what is harm reduction, to help people to understand what harm reduction is, think about putting on your seatbelt when you get in a car. Think about brushing your teeth in the morning. All of those are harm reduction strategies. The same is true with drug use. I mean, you want to make sure that people understand that if they are injecting, they have clean needles. They're not sharing their needles with people because you can pass along bloodborne illnesses. And you want to make sure that people have appropriate lighting. You want to make sure that people understand something about dose. You don't take too much and you may get in trouble. All of these sort of things are harm reduction strategies, just like we do when we, as I pointed out, we make sure people have windshield fluid in their car in rainstorms so that they can make sure they can see. All of these things are harm reduction strategies.
Dr. Carl Hart, this is a fascinating conversation and certainly a controversial one. But if harm reduction is the goal and supports more people, I think we should keep talking about ways to get there for sure. Thank you so much for coming on Amplified tonight. Appreciate your time. For our viewers who want to learn more, check out his book, Drug Use for Grown-Ups, available in paperback in January of 2022.